So this chemical has been around for 100 years, been causing cancer for a century, and it's associated with a 500% increased risk of Parkinson's disease in one modified twin study. And Marines, U.S. Military service members who served at a base that was contaminated with this chemical in their 20s, when they were young, largely men, generally healthy, 33 years later had a 70% increased risk of developing Parkinson's disease compared to service members who served at a much less polluted base. And again, laboratory scientists in the United States and around the world have demonstrated that this chemical reproduces the pathological and clinical features of the disease in laboratory animals.
Right. And what do you suggest that people do to protect themselves from exposure to?
So one, we need to ban the chemical. Two, we need to give people the right to know if they live, work, or study near these near sites that use this chemical. Three, we need to avoid co-location of sites that use this chemical with schools, with apartments, and with grocery stores. Four, you can put a water filter on your water to decrease the likelihood that you're getting exposed to this chemical. Five, you can test the water. If you have water that gets from a well, 40 million Americans, 1 in 8 Americans get their water from a private well on their property. That's not regulated by the Safe Drinking Water Act. You can get that tested. Next, you can use a dry cleaning company that doesn't use this chemical, so that when you're dry cleaning your clothes, so your clothes don't shrink, you're not exposing yourself to a chemical that might be increasing your risk of Parkinson's disease. Living within 1 mile of a golf course, which is a heavy user of pesticides, is associated with 126% increased risk of Parkinson's disease.
Welcome, everybody. So today I'm speaking with Dr. Ray Dorsey, who is a neurologist, researcher, and one of the leading voices in the movement for prevention of Parkinson's disease. Dr. Dorsey is a professor of neurology at the University of Rochester, and he's also the co-author of a book that's coming out just around the same time as this podcast episode, and it's called The Parkinson's Plan. And what I personally appreciate about this book and Dr. Ray Dorsey's work in general is his focus on taking action as an individual, as a society, things that we can actually do to both on a population level reduce the risk of Parkinson's and also on a personal level. And so it is with appreciation for that action focus that I bring to you Dr. Ray Dorsey and my conversation with him. Welcome, Ray Dorsey, to the podcast.
Thanks very much for having me, David. Delighted to be with you.
So you've been writing books about Parkinson's and how it's, in your view, a preventable disease, right? Do you want to lay out your view on the preventability of Parkinson's disease?
Sure. So Parkinson's disease was first described in 1817 by a British surgeon, Dr. James Parkinson, who described 6 people with the disease. And he said it was classifying something new, something that hadn't been classified in the medical literature. In his mind, it was a new disease. And if you think about this, Parkinson's disease has got some clear characteristics, and although there's some very rare ancient descriptions of the disease, what was bringing about this new disease in London in 1817? So he's describing the disease at the height of the Industrial Revolution in the capital of the Industrial Revolution, London. And air quality in 1800 London is as bad as it is in Delhi, India today. It was so air pollution was so bad you couldn't even see across the street. And since then, numerous studies have linked environmental factors, including air pollution, certain pesticides, and dry cleaning chemicals, and including this chemical called trichloroethylene, to Parkinson's disease. And we've also known for over 100 years that Sir William Gowers, over 100 years ago, said that only 15% of his patients with Parkinson's had a family history of the disease. And that has been largely replicated time and time again. Only about 15 to 20% of people with the disease have a family history. And then there have been two large-scale genetic studies, one principally in the United States called PD Generation, and one in Europe, the Americas, and the Middle East, which have signed up individuals with Parkinson's disease to undergo genetic testing. And both those studies have found that less than 15% of people signing up to participate in a study of the genetics of Parkinson's disease carry a genetic risk factor or genetic cause for the disease. So almost everything we know about Parkinson's disease suggests that at least 85% of people with the disease have no significant genetic contribution to the disease, and the biggest risk factors for the disease aren't the most common risk factors for disease or causes aren't in our genes, but are in our environment.
Right, right. And that also opens up for the potential for, taking action as an individual, right? To prevent, or I guess reduce the risk is a better phrasing of it.
Yeah, I think we can be a little bit bold here. I think when I see someone with Parkinson's disease, I get upset. I get upset because Parkinson's disease is a terrible disease, and I think the vast majority of cases, Parkinson's disease is preventable. It's unnecessary. Lung cancer didn't exist in Europe until the late 1800s, and the physicians at the time were wondering why was this new disease, lung cancer, appearing. Some German pathologists even went to look at their old cadavers to see if they had missed occult malignancies, and they hadn't. And it turned out that lung cancer was a product of smoking cigarettes. And 25 years after cigarettes are introduced into the United States, you see a corresponding rise in lung cancer deaths. Lung cancer deaths in the United States in 1900 were almost non-existent. Lung cancer just, for the vast majority of those, just didn't exist. It was so unusual, it was considered a once-in-a-lifetime oddity. Doctors and medical students would gather around thinking they would never see a case. And as soon as we stopped smoking in the 1970s in the United States, you see a corresponding decrease in the number of lung cancer deaths. So I think the vast majority of Parkinson's disease is preventable. I think the suffering people have is unnecessary. I think that's an indictment of people like me, physicians whose job it is to identify the causes of the disease. I think it's an indictment of scientists. I think it's an indictment of funders, indictment of society that we're allowing, according to the Global Burden of Disease Study, 11.8 million people to suffer with Parkinson's disease today, and for Parkinson's disease to be one of the world's fastest growing brain diseases.
Right. And as you mentioned there, it's a very fast growing disease compared with other diseases in general, but also specifically in the category of neurological diseases, right? And so do you think that is in itself evidence of it being in large part non-genetically induced disease, environmentally induced?
Yeah. So, but look, sometimes I think we overthink this. In general, you can have common genetic causes of rare diseases, and you can have rare genetic causes of common diseases. But you don't have common genetic causes of common diseases. That just doesn't exist. So if you look at where the leading causes of death in the world, heart disease, not primarily genetic. Cancer, vast majority of cancer, not genetic. Stroke, minimal contribution from that. Congestive heart failure, liver disease, COPD, the list goes on and on. I mean, for every alpha-1 antitrypsin deficiency that causes emphysema, you have, probably 100 people getting emphysema from smoking. So you can't have a common cause of common disease because they would have been selected out long ago. And the fact that Parkinson's disease is growing faster than even the other brain diseases for which our diagnostic abilities unquestionably improved. Your ability to diagnose multiple sclerosis is much better than when I was in medical school. Your ability to diagnose individuals with stroke with imaging is much better than when I was in medical school. Yet those diseases aren't growing nearly as fast as Parkinson's disease, suggesting something else is driving this. And if you look at the map of Parkinson's disease, it's not uniform. It's not just spread out like genes, random distribution of genes. Rates of Parkinson's disease are highest in the industrialized world, lowest in the least industrialized world, and increasing most rapidly in countries undergoing the most rapid industrialization, like India and China.
So you think that the major risk factors, possibly you might even go so far as to say causes of Parkinson, are these environmental pollutants,
So I think we
chemicals
just
that
need to
we
stop
as humans have.
sugarcoating things.
Yeah.
Diseases have causes. Diseases have causes. So this is from Hippocrates. Diseases have causes. So the only question is what causes the disease? Western medicine thinks that there are causes for the disease. Now, those can be intrinsic factors, and in some cases, genetics. Down syndrome has an intrinsic thing. Huntington's disease, I spent a decade working on Huntington's disease when I was a young faculty member. One gene determines whether you get Huntington's disease or not. Cystic fibrosis, these things. But lung cancer, heart disease, cancer, Alzheimer's disease, Parkinson's disease, these are largely not dictated by genetics. There are rare genetic causes of Alzheimer's disease, rare genetic causes of Parkinson's disease. For the vast majority of people with these diseases, the answer lies not in our genes, it lies in our environment. And there are environmental causes of these diseases, not risk factors. There are environmental risk factors, but they're just environmental causes. I don't, if our failure, you're going to medical profession to accurately identify what's causing a disease is a failure. I mean, how can we just not say we're walking gingerly around smoking causes lung cancer? The U.S. Surgeon General reached that conclusion in 1962 after generations of people died from lung cancer. I never met either of my grandfathers because they died from smoking related illnesses. If we take actions to prevent people from getting exposed to these toxins, we prevent people from suffering, from dying prematurely. We reduce healthcare expenses. We allow people to live longer, healthier, fuller lives. I can't think of there are few responsibilities I think that future physicians have, and to improve the health of the populations that they serve.
Yeah, I definitely agree about that. That once you have a clear understanding of the data and that there are causes of a disease such as Parkinson's, it's very valuable to be clear in the communication that is what they are. They are causes of the disease. So I appreciate that you're clear in that communication.
And so why isn't it clear? Why are you so hesitant to do that? And I think sometimes the truth is hidden from us. So tobacco companies had physicians detail the health benefits of smoking before it became clear that smoking caused lung cancer. Tobacco companies knew far in advance about the health hazards of it before the public did. And it's not just smoking. I mean, we've seen the same thing play out with lead in gasoline, lead in paint. There was likely a reason why paint companies had a Dutch boy advertising for leaded paint. And even though leaded paint, we know, contributes to lead in children, which contributes to lower intelligence and lower IQs. We've seen the same thing with social media today. Your generation, there are reports from the Wall Street Journal and other top newspapers that social media companies know about the health hazards of their things and concealed it from the public. So the idea that there are products of industry that have health consequences and that can cause or contribute to diseases is not news. It's not, it's not a news flash, news bulletin. This is exactly what's been playing out for decades, if not centuries.
Yeah. I mean, it makes sense mechanistically as well. The reason I'm personally hesitant to, fully commit to the idea is that I just haven't looked at the data myself. Whereas I trust that you have, and so I like to have this conversation with you. So can you mention some of the chemicals that are present in the environment today and that haven't been banned yet, and what people can do to, reduce their exposure to those chemicals?
Yeah, so one is a pesticide called Paraquat. It was created in the 1960s. It kills weeds. It kills the weeds that Roundup can't. It's so toxic. It's been used to commit homicide and suicide. Over 50 countries, including China, have banned it. Many European nations have banned it, but the United States has not. The United States Environmental Protection Agency has a website and it says once it can kill. And human studies has been associated with 150% increased risk of the disease. In multiple animal studies by multiple academic investigators around the world, it reproduces the clinical and pathological features of the disease. According to reporting from The Guardian, a chemical manufacturer had exposed mice, rabbits, and rats to Paraquat in the 1960s and reproduced features of disease, including tremor. So a chemical manufacturer knew about its pathological links to Parkinson's in laboratory animals 30 years before academic scientists had reached that same conclusion. So that's just one. There are others. This dry cleaning chemical called trichloroethylene. That's a really simple molecule. You and your listeners know that water is made up of 3 atoms, H2O, 2 hydrogens, and 1 oxygen. Trichloroethylene is made up of 6 atoms, 2 carbons in black, 1 hydrogen in white, and 3 chlorine atoms in blue. It's also got a cousin named perchloroethylene, which has 4 chlorine atoms. These chemicals have been widely used in dry cleaning, been used to degrease metal. Trichloroethylene was even used as an anesthetic agent, especially for pregnant women. It's known to cause cancer, according to the World Health Organization and the U.S. Environmental Protection Agency, and it's been around for 100 years. So this chemical has been around for 100 years, been causing cancer for a century, and it's associated with a 500% increased risk of Parkinson's disease in one modified twin study. And Marines, U.S. Military service members who served at a base that was contaminated with this chemical in their 20s, when they were young, largely men, generally healthy, 33 years later had a 70% increased risk of developing Parkinson's disease compared to service members who served at a much less polluted base. And again, laboratory scientists in the United States and around the world have demonstrated that this chemical reproduces the pathological and clinical features of the disease in laboratory animals.
Right. And what do you suggest that people do to protect themselves from exposure to trichloroethylene?
I'll tell you what what they've done in Germany. They found that grocery stores that were simply located near where dry cleaners that were using this chemical and its dry cleaning chemical cousin, those grocery stores, when they looked at the dairy products, at butter and cheese in those grocery stores, they found perchloroethylene in the butter and the cheese. So in Germany, they prevent the location of grocery stores near dry cleaning outlets. In the United States, in New York, where I'm sitting right now, they found unsafe levels of the dry cleaning chemical in apartments above dry cleaners. In at least 5 continents around the world, including Europe, trichloroethylene has been found to be contaminating the groundwater. So individuals who, for example, might be getting their water from a well in industrial areas could be drinking in this cancer-causing chemical. So 1, we need to ban the chemical. 2, we need to give people the right to know if they live, work, or study near these near sites that use this chemical. 3, we need to avoid co-location of sites that use this chemical with schools, with apartments, and with grocery stores. 4, you can put a water filter on your water to decrease the likelihood that you're getting exposed to this chemical. 5, you can test the water. If you have water that gets from a well, 40 million Americans, 1 in 8 Americans get their water from a private well in their property. That's not regulated by the Safe Drinking Water Act. You can get that tested. Next, you can use a dry cleaning company that doesn't use this chemical, so that when you're dry cleaning your clothes, so your clothes don't shrink, you're not exposing yourself to a chemical that might be increasing your risk of Parkinson's disease. We have all these recommendations and more in our new book called The Parkinson's Plan, which comes out August 19th. People can learn more about the book at endingpd.org, endingpd.org.
Yes, and I will link to that in the show notes of this podcast as well. So trichloroethylene, is that the most common and the one that you believe causes the most cases of Parkinson's amongst the chemicals in our environments?
So we don't have good data on that, and that in of itself is problematic. Why are we not seriously addressing the root causes of one of the world's fastest growing brain diseases? I'll just say in the book, we make the argument that in the United States, that trichloroethylene may be one of the most important causes of the disease. I think the causes vary by geography. So if you live in a country or an area that's heavily agricultural, my guess is certain pesticides, not all pesticides, certain pesticides are likely the principal causes or contributors to the disease. If you live in industrial areas, trichloroethylene may be. If you live in areas with high degrees of air pollution, although there's more research needs to be done on air pollution could be a significant cause or contributor of the disease. The role of air pollution is, whether it's an environmental risk factor or environmental cause, still needs a work to be determined. And there are likely other environmental causes that have been much less studied. Heavy metals, for example, other similar halogenated compounds may also pose a risk.
And so,
PCBs.
Right. And so are these chemicals of various sorts that you mentioned, are they possible for individuals to go out and measure by themselves in their own environments?
I think it might be hard.
Yeah.
I'll tell you what we do is at the end of the book, we give you the Parkinson's 25. So we give you 25 actions that individuals can take in their everyday lives to reduce their risk of getting Parkinson's disease. And if you already have the disease, these could help slow the progression. I'll read you the first one just to give you an idea, which is to wash your produce, even your organic ones. And it says that pesticides have contaminated our food supply. Remnants of pesticides are found in 20% of common foods. This is based on research done in the U.S. Organic produce, dairy products, and meat can reduce exposure, but can still have unsafe residues of pesticides. So organic produce in the United States, not only can it have residues of pesticides on it, which begs the question, what's the label organic mean, but can even have unsafe levels. So wash your produce, at least with water, and consider simple vegetable washes, vinegar, or salt solutions too. And so we give you 25 recommendations for what you can do in your everyday life. Change your diet, make sure your grocery store is safe, enjoy wine without pesticides, farm safely, check your well. All these things that you can do in your everyday life to reduce your risk of ever getting Parkinson's disease. And if you already have the disease, perhaps slow its progression. First recommendation we make to a smoker who has lung cancer is to
stop smoking. Yeah.
Stop smoking. And so why aren't we doing the same thing for people with Parkinson's disease? Why aren't we telling them to try to figure out what might have been causing the disease and make sure that they're not still getting exposed to those toxins that could be contributing to the disease?
Yeah, it makes sense logically. And I know that there are that's an interesting topic that we talked about earlier as well, like the degree of hesitancy versus confidence that one should have when thinking about interventions, for example, that might slow the progression of certain diseases. Oftentimes I feel that people in the medical field do have a high bar for the amount of evidence that they want to see before they start stating that something slows the progression of a disease, for example.
Yeah, I think sometimes we just need to think. So I'm actually unaware of any study that's looked at smoking, lung cancer outcomes among smokers who continue to smoke or people who stop smoking. I think it's just logical that if smoking causes lung cancer, you should stop smoking. And I think it's also not terribly illogical to say that if a farmer's working with pesticides and gets Parkinson's disease, it might be good to think about ways of reducing pesticide exposure, at least certain pesticide exposure, if they have the disease. And our failure to make such advice and counsel, the downside is that we're letting people progress with the disease. We're letting other people in that farming house be exposed. We are allowing what is likely an important cause of disease to be unaddressed. What's the downside? If we're wrong, many pesticides are endocrine disrupting compounds. Some pesticides are linked to cancer. If we're wrong, we're just likely getting other health benefits to the people as well. And same with trichloroethylene. I mean, the World Health Organization says it's carcinogenic. The U.S. Environmental Protection Agency says it's carcinogenic by all routes of exposure. Unless these agencies are all entirely wrong, why shouldn't we be telling people to reduce their exposure to trichloroethylene? Why aren't we asking, why aren't you being taught about trichloroethylene? One of my former research assistants is an oncologist trained at the top institution in the United States, never was taught about trichloroethylene. I was never taught about trichloroethylene, went to the oldest medical school in the United States. I don't think I was told a single sentence about trichloroethylene, even though it's known to cause cancer, and even though it's associated with a 500% increased risk of Parkinson's disease. I think we just have some failures, even in our medical training, that aren't being addressed. Again, for common causes, we should be looking for what, the first question for the disease is what causes it. Because if you want to cure a disease, I mean, you're in medical school. Can you name a disease that you can cure where you don't know its cause?
No, I don't think so.
So everyone wants to cure Parkinson's disease, but no one wants to figure out what causes it? I mean,
I think people are trying to figure that out.
So if you look at where money is being spent on Parkinson's disease research, there's 6 times as many studies on the genetics of Parkinson's disease than on the environmental causes of disease, even though it's likely that the environment are 6 times more important than genetics. I would submit to you that we're not being very serious about trying to find out what the causes of the disease are. And I would submit that this isn't just happening for Parkinson's disease. And if we're not serious about finding out what the causes of the disease are, we're not going to cure them. To think you can cure a disease medically, you can cure like appendicitis surgically, so that there are lots of surgical cures, but we're not likely to have a surgical cure for Parkinson's disease in the near term. If you want to cure a disease, you should really try to figure out what its cause is. For you, peptic ulcer disease is cured with an antibiotic. Yeah, and antibiotics. So it used to be think that peptic ulcer disease, was due to stress. And so people were being told to quit their job and change their lifestyle. And in reality, it was due to Helicobacter pylori. And so bleeding ulcers went from a top 10 leading cause of death in the 1960s to no one dies of peptic ulcer disease. Very few people died from peptic ulcer disease because it's curable with an antibiotic. These are all things that have happened. It's not like ancient history. This happens all the time. Hepatitis C for you is a curable disease. It wasn't for when I was in medical school. It was the leading cause of liver transplants in the United States. It was a bloody mess. But we figured out that hepatitis C was due to a virus, and people unsurprisingly were able to come up with antiviral therapy. So hepatitis C, once a leading cause of death, leading cause of hepatitis in the world, is curable with antiviral therapies, with a pill.
Yeah. So I really do appreciate that you do have this action focus in your communication and in your book. What, other than being more aware of the chemicals that people are exposed for, do you think that individuals can do? You mentioned changing their diet, maybe exercise, maybe some other interventions. What are the, let's say, 3 most important, in your view, interventions for prevention of Parkinson's?
So the book is organized. So what are the chemicals in our food? Chapter 1 that are contributing to Parkinson's disease. What are the chemicals in our water? Chapter 2 that contribute to these. What are chemicals in our indoor air that contribute to Parkinson's disease? and what in our outdoor air. So I said in the United States, and again, it might vary. It might be different in Sweden. I think has banned trichloroethylene. I really get worried about exposure to trichloroethylene. So I try to find out where is trichloroethylene likely to be found and what are things to be done. I think air purifiers would be a very easy one. There's good evidence linking air pollution to Parkinson's. There's great evidence linking air pollution to dementia. So I would think about an air purifier. You can roll up when your window is in traffic. You can recirculate your air in traffic. So that's another one. I think people should stop being indiscriminate about pesticide use. Number 11 here is don't poison yourself. And number 18 is be mindful of greens. A study just came out that showed that in the United States, living within 1 mile of a golf course, which is a heavy user of pesticides, is associated with 126% increased risk of Parkinson's disease. I think that's those things are all extraordinarily easy to address. Could golf courses use 50% less pesticide? Could they spray less frequently? Could they use less toxic pesticides? I think the answer to all those things is a resounding yes. And our book is called The Parkinson's Plan because we actually give you a plan. Not only do we give you 25 recommendations that individuals can take to address the disease, but we give you chapter 10 is actually a plan. And I'll read you, I think, one that I think we could all agree we should do. And that is to create pesticide-free schools. So I'll just read you a story. In 1998, Rabina Sewell dropped off her son, Nicholas, a kindergartner at Sherman Oaks Elementary School in Los Angeles. As Nicholas was turning to kiss his mother goodbye, he encountered a cloud of weed killer sprayed by a man in a hazmat suit who'd been treating the school's hedges. Nicholas said, "It tastes terrible," and began to wheeze. He asked his mom if this would happen again. His mom promised it wouldn't. 2 years later, spurred by Sewell's activism, the California legislature passed the Healthy Schools Act. The law requires that all kindergarten through 12th grade public schools and licensed child care centers develop programs that minimize the use of chemicals and focus instead on weeding, removing dead plants, and employing trap. The bill bans the use of high-risk pesticides on schools and surrounding parks, and schools that use pesticide must notify parents annually. The right to know law should serve as a model for schools nationally and beyond. I think we could all agree that as we could eliminate the use of pesticides on schools and playgrounds. Kids don't mind weeds. Why are we spraying some chemicals that are known to be neurotoxins on areas that are known to be exposed to children who are known to be at higher risk for exposure to neurotoxins than adults? Because they're smaller, because they have a high body surface area, because they have a higher respiratory rate, because they're more likely to play in the dirt. Yet we're doing this. What kind of society, what kind of world are we creating where we're spreading indiscriminately neurotoxins on the playgrounds of the future generations of humans?
What do you think that the people who are in charge of making those decisions of spraying those chemicals there would say to their defense, or would they have anything to say to their defense, or is it just an purely economical decision for them?
So you should ask them. They can speak for themselves, but
Right.
Those people are us, right? I'm a parent. I don't know if you're a parent, but maybe you aspire to be a parent, and lots of your listeners are parents, and lots of parents are part of parent-teacher associations. Why can't parents ask their school administrators, are you spraying pesticides on our kids' playgrounds, and why are you doing so? And what alternatives are there? We don't have to sit around and wait for other people to make decisions. We can take agency. We have power. Schools are nominally for the benefit of our children. Why aren't we making our voices heard and changing it? Why aren't doctors making their voices heard and saying that this is an inappropriate use? Why aren't pediatricians making their voices heard? We did this for drinking and driving. We've done this for lots and lots. We do HIV education. You would think it would be a failure or responsibility of you and your generation not to educate people about safe sex practices. I would argue, wouldn't it be the same thing to not be arguing about safe use of pesticides? We don't need to wait for others. This is all, we give you actions that are directly in individual control, and some of these actions are directly well within the control of communities of individuals.
If listeners take away just one message from this conversation, what would you like that to be?
That we can create a world largely free of Parkinson's disease. Look, you and I have inherited a world largely free of polio. We've inherited a world where HIV is preventable and treatable. You know, I was coming of age in my medical training when HIV was running rampant. HIV levels, incidence, number of new cases of HIV today, thanks to activism from medical students, from the public, from physicians, from people most directly affected by the disease. The incidence is at the lowest level since 1990. HIV, which used to be a top 10 leading cause of death in the United States, is now outside the top 50. HIV might disappear as a major clinical entity in our lifetime if we continue our efforts to prevent and treat the disease. These are all gifts that we've received from previous generations, right? You didn't play a role in the HIV, you didn't play a role in polio, you played a role in drinking and driving, but you have an obligation to receive a gift and you have an obligation to reciprocate. And I can't think of a better gift that a neurologist can give is to future generations, a world largely free of terrible neurological disorders. And our book makes a strong case that Parkinson's is largely driven not by factors within our bodies, but factors within our environment. If we change our environment, we prevent people from ever suffering with this terrible and devastating neurological disorder.
Yeah, that's a very inspiring vision, I think. And thank you, Ray, for coming on the podcast.
Thank you very much for having me, David. And thank you for all your future contributions to the medical field.